educational institute, if we talk about schools or colleges, to monitor their health education of their students or wards. In a preschool, every teacher should find a way to incorporate the interest in the hand washing by a way of songs and to impart a new methodologies to track hand washing techniques. And if anybody are found to be adhering a proper protocol of hand washing, they should start giving rewards. And in a primary school, there should be a self-learning encouragement attitude should be encouraged, and expressing their concerns and monitoring stress and mental health should be monitored in the primary school area, where they are very sensitive towards this outer atmospheres. And in the secondary school, again, addressing the concerns, monitoring the hand washing practices, and making them responsible health advisories or health authorities inside the school campus or in their homes can be done. For the college students, their mental health can be addressed, safe practices can be advocated, safe waste disposal practices can be advocated, ask them to implement, and we have to make them responsible persons for monitoring of these waste disposal practices. For postgraduates and other university campuses, they can find out new innovative technologies to cope up with current scenarios, like economical ways to clean the entire campus with implementing of waste disinfection practices, reduction of PPE consumption every day, etc. So before going to now, after seeing who are the stakeholders in establishing a safe and healthy environment in the schools, so let us think, are we ready for the reopening? Can we reopen the educational institutes? What are the criteria that we should take into consideration when we want to reopen the educational institutes? I just want to say that this is not only a problem of South India, North India, or in India. It is a common thought process right now going on in the entire world faculties. So, what decides the reopening? Let us think about it. Are there any guidelines in the reopening? I just want to share about a few points or few insights into the new points which decides the reopening. Apart from the child homes, like educational institute is has got a more influence on the child health. So before opening the educational institutes, the educational institutes should take into consideration the level of COVID-19 transmission in the community as an important factor in determining to go back to person-in-person instruction. So the schools or educational institutes may be required to begin distance learning whenever there is a rampant infection, or when it is coming down or becoming stabilized, a blended learning, and when it is coming down, having a decreased trend in the society, then we can think about coming back to in-person training. But what decides it? CDC has got a criteria called gating criteria, which is available, which says that there are few points or parameters have to be taken in consideration for about a period of 14 days. And then depending upon it, you estimate how much percentage of rise of cases are there. I just want to take an example of Visakhapatnam as a criteria here. 4 days back, Visakhapatnam, if we think that there are 847 cases are there, next day 1000 cases are there, and the other day around approximately 1200 cases are there, then when we note down this outbreak of the diseases, then there is a certain percentage of rise of cases have been observed. So we need to plot them for about a period of 14 days and have to observe how much percentage of rise of cases are there in the outbreak of diseases. So that has to be taken into criteria. Along with it, a few other criteria are also being there. but I just want to simplify. So we have to take certain benchmarks to reopen education institute for in-person instructions. So the CDC defines the community spread as follows: minimal community spread, moderate community spread, and substantial community spread. In minimal community spread, there is an evidence of isolated cases or limited community transmission. Case investigations are going on. There is no evidence of exposure to large communal settings. Moderate thing, there is a rapid potential of increase in cases will be observed. And substantial community spread, like large scale uncontrolled cases, outbreak of cases will be seen. So you can see that in minimal spread, less than 10 cases per 100,000 population. Moderate, 10 to 100 cases per 100,000 population. Substantial cases, greater than 100 cases per 100,000 population. So the percentage of positivity is less than 5%, 5 to 10%, and greater than 10%. So if these criteria can be taken into a criteria and can be set as a benchmark, then we can know whether to come back or whether not to come back. So what to see? In a minimal transmission, yes, you can plan to come back. You can think about asking half of the people to come back and to start the daring daring to start the in-person instructions. And these are the additional consideration for offering in-person instructions, like specific health benchmarks, a 2-week decline, and present positivity, there is less than 7% positivity, and COVID-like illnesses are less than 10%. So by creating such initial reopening checklist or benchmarks, then the coming back strategies can be taken place or thought about. So I just want to touch about how to wearing a mask. Everybody we know that do's and don'ts of wearing mask, because consistent wearing of a mask, consistent wearing of a mask in a proper way, and the proper removal of a mask or storage of a mask places a very pivotal role in maintaining a healthy environment or also risk transmission. And how doctors and nurses wash their hands, now it's become a common etiquette to entire household. I think in this aspect, even now, even the kids, small kids at home, now they tell us what are the 8 steps of hand washing techniques and how do they wash, etc. So now this is not only a knowledge of a doctors and nurses. At the same time, the symptoms of COVID virus or COVID-19 should be uh, uh, more and more educated to the staff, etc. So, any emergency warning signs, remember, suffering for a fever for continuous 2 days might have might have been a normal attitude before, but not now. So, if you have a dry cough, if you have a little bit of difficulty in breathing, and a fever for more than continuously for 3 days, a severe pains, body aches, and associated with diarrhea, new loss of taste or smell, then consider that these are the warning signs of the COVID-19. So, implementing physical distancing in the infrastructure, in the educational institutes is a very, very meticulous thing. So, if anybody always think that, do I have to measure the 6 feet in the education campus, just keep in your mind that your routine sleeping bed measures 6 feet. Just think that there are about seven and a half, 1, 2, 3, 4, 7.5 basketballs. They measure about 6 feet. So you can ask your janitors, your people who are rearranging the classrooms, that this is the approximate 6 feet distancing that you have to incorporate it. So I just want to take an example of a new school day, if at all it is opened with a reduction in the cases. So before leaving the home, just monitor the sickness. If any symptoms are there, stay back at home. Fill your own water bottles, pack your own lunch. So then the kids will board the bus. Once the kid boards the bus seating should be staggered, should be separated. So there is nothing like a loading loads of students in the buses like before. These points have to be meticulously planned. And next, at the school, as soon as the school students enter back to the school, check for the symptoms. And when the students go back to the classrooms, they go back to the classrooms where space ducts are spaced apart with a 6 feet difference wherever feasible. The lockers and hallways should be reduced for the scheduled access, and overcrowding should be avoided. Washing hands should be encouraged whenever the crowds they come and join together. Drinking fountains, that is in the foreign scenario, should be hands free. But for us, hand washing and cleaning of the common taps should be encouraged. Lunch, spaced seating, staggered outside. Bathrooms, uh, enhanced cleaning of the bathrooms, availability of the hand washing and soap and water, this thing. And while picking up, if the buses are completed, alternate pickup departures and the student go back to the house. And always during the entire process of entry into the school and leaving the school, the mask should always be on. So for the safely returning to in-person instructions, I have summarized this in the slide, what should be taken care of. I have a few points picked up from the like various uh, consultancies when they have advised for the reopening of the higher educational institutes. We should always remember that any universities or higher education institutes are like mini cities, and we have a global citizens in these mini cities. The global citizens might be from the different places, different states, etc. So there is a close interaction between students. That is, sometimes if they are asymptomatic and they come back, so these situations should be thought about, anticipated, and they should be spaced out. And various risk profiles, like new joining of faculty, coming from outside daily through a public transport. All these high risk profiles should be anticipated. And as an local community inside the campus, should be able to train the student, should be able to educate the student, should be provide essential services, healthcare, food, etc., and bring back the unique configurations of the risks. So these are the various 10 points for the reopening of education institutes as suggested some consultancies. These 10 points concentrate on local conditions of the health system capacity, that is monitoring your educational outbursts, and testing, tracing, and other protections in the campuses of the students, protecting the vulnerable population. So if there are allergic populations are there, highly diabetic individuals are there, more than 85 more than 65 age group individuals are there, you should have your separate policies for protection of vulnerable populations. Universities should employ their own safeguards. Like how do I have told you, the spacing out of the classrooms, spacing out of the athletic rooms, gyms, etc., residential occupancies, dining and student activities, offices, while coming the large crowding while paying the fees, etc. So various scenarios of reopening. So we have seen what are the scenarios of reopening, and maximize the missions in the next normal, detailing the operational planning to all the employees and the stakeholders. At the same time, governance and compliance, monitoring these policies have been taking place or not, communication, and anticipating the financial impact in the risk mitigation plans should also be done. So testing, contact tracing, and confirmed cases quarantine policy. What are the other campuses-wide health and safety policies? I just want to touch on these areas. All other areas might be familiar to the all the teachers aggregated or congregated in this FTP. But I just want to tell what are the tests available right now. How do the contact tracing work? And what we should do with the confirmed cases, what do you understand by a quarantine and an isolation, and what are the other campuses wide health safety policies you should be taken care of. Right now in India, for the identification of COVID-19, we have different types of tests. Some genetic based tests, which are called as confirmatory tests. So whenever you see outside, people will say that my PCR test has come positive. What should I do? Yes, any SARS-CoV RT-PCR test which detects E gene and S gene are confirmed positive cases. Some of the times, the COVID cases can be confirmed by doing a TrueNAT test by saying that this patient is a confirmed case. Remember that nowadays the chest HRCT, whatever it is being done, yes, it does help it when the person is having a shortness of breath, but it should be always coupled with a confirmatory test. Then only a person can be said to be confirmed COVID positive. There are certain tests called antigen tests. There are certain tests called antibody tests. What do they help? What do they do to us? Antigen kits like SD Bioline kits, they are easy to administer. Sometimes you can have keep them in your own settings. You can test or screen this, but that requires permission by a healthcare authority. Sometimes when you are calling back the large number of population into the campuses or the universities, you have to screen. You don't know whether they have already had an asymptomatic infection and had developed antibodies. At this time, the antibody based test comes in hand. By doing an antibody twist test, some of the faculty might be aware of, they might have underwent antibody tests also. So they are positive for the antibodies. Remember, being positive for the antibodies is not a disease. It is a sign of exposure and a measurement of an immunity. So all antibody based tests are indirectly are indicators of immunity. So these can be employed while testing the students. So with this, many of the faculty might be thinking, why can't we implement antigen tests to the students while they come back? Or why can't we implement antibody tests to all the people when they come back? Yes, you can think, but always think that whether you need to get associated with the public health authorities. You have to think that if you need to send the swab testing in your university campuses, what are the requirements do you require? Who are the exact personnel to take them? How safely you have to transport? Because everything is associated with any breach will result into the epidemic breaching. Because it's a pandemic, any breach will result into the spread of infection into the respective personnel. And testing capacity, and what are the operational barriers in implementing this? So, when diagnostic testing is implemented for contact tracing, you can try this like once some persons are positive, you have to identify who was the person who had come with a close approximity of the positive person. Remember that any positive person is capable of transmitting the infection 2 days prior to the appearance of the symptoms. So if somebody they have observed their symptoms and went back for the testing and turned out to be positive, for example, say yesterday, remember that 2 days before yesterday, the people who are all in close proximity, that means who have come in less than 1 meter distance or who have spoken to them for more than 15 minutes, they are at risk. They should be identified by the educational institutes and they should be also tracked back and tracked or traced, and they should be asked to stay back at their own places, observe their symptoms, and after 5 days, get their testing done and come back to the places. So there are broader testing surveillance strategies are present, but these are there for the large community screening rather than this. So what are the challenges? Certain individuals have an increased risk of complications from the virus. Remember that. You might be seeing that some few younger people are succumbing to the disease, few older people are succumbing to the disease. But always think that we have to keep in mind who are the vulnerable population in the educational institutes, like 65 years and older, who have an underlying conditions like asthma, hypertension, and diabetes, immunocompromised people like having a cancers or who are undergoing any beta-methasone injections, hospital workers, and students without health insurance or anybody without health insurance coming from a high-risk areas. So always plans has to be made, policies has to be made to keep them in mind, to monitor their health signs, and keep them whenever they are at a distance. And the other important criteria or area which I have been reiterating again and again is mental health and substance use. Substance use can be anything. The proper mental health is an critical point in maintaining or the running back of the going back to the original old normal in any education institutes. If any of the student faculty they have lost their dear ones, there is every chance that they get accustomed to the substance use like alcohol or any other drugs. And then we also have to take care of and anticipate these among the students and the employees. So these are the internal safeguards which we can apply and which we have already discussed before, like classroom and faculty, research, student and laboratories, residential occupancies in the universities, dining, student activities like club activity, off campus and on campus activity. Sometimes certain programs are twinned with abroad, but right now all those twinning abroad study programs had a curfews right now. And offices, we have to take care about their entrances, exits, stairwells, etc. And athletics, fans, athletic scheduling, staff recruiting, and tracking of confirmed cases. And if at all, if any faculty are coming with the child, we have to take care of their child care, etc. So in all these, we have to think about in the atmosphere, what are the most restricted areas, moderate restricted areas, etc. These are the various examples how we can implement the safeguards in the educational institutes. Like standing apart, employees serving customers standing 6 feet apart with each other with a visual distancing cues. That means all these distancing cues should be pasted upon the floors. Where should they stand? In fact, every educational institute should communicate with their staff, employees, and students through these symbols in the educational institutes. Sometimes, if the students do not have brought their carriages, there should be a provision of a pre-packed food items should be picked up, and always with a sign that take whatever you touch. Don't leave the food pack whichever you touch. And checking out with the contactless payment should be encouraged. And people or students or the faculty sitting apart and eating their dinners and lunches, not sharing their lunches should be encouraged. There are no days nowadays to sit together, have enjoy our lunch parties with our fellow colleagues. This is not the time. So we have to encourage this idea and tell them the significance of this. So the gating criteria, which I have always touched before, I just want to tell you that when we can exactly think about the interactions, about going back to the reopening this thing. Initially, whenever high infection is there, the low workplace density can be planned and a high student and public interaction on through online can be planned. Low workplace density and low students in a very high exposure of the infection. High workplace density can be planned when there is a normalcy is observed and low student can be interaction can be seen. And when every situation comes back to normal, high workplace density and high student and public interaction can be planned. And this is the reopening archetype. And this reopening archetype is based upon the CDC gauging criteria. In fact, every educational institute should have their own dashboards that indicating that which zones are in red, which zones are in yellow or a green, so that we are constantly aware and transmit this infection based on it. And research potentials are always there to explore. We have to encourage the research platforms for developing the data sets for the students and faculty to conduct research virtually, and also to overlap or give incentives to for the new innovative technologies and apply their innovation in the risk mitigation strategies of COVID-19. And as I've always said, once all these plans have been implemented, there should be a governance and adherence policies to monitor that whether these policies have been continuously taking place uh, and continuously being monitored, whether the data that is procured that is being properly tracked, whether the resume supplies that are being continuously monitored to be uh, made available for the employees, students, and the staff. So I think with this, I could give a little bit of insights. So how important is the health and safety of creating a safety environment in the educational institutes? And I thank you all for your patient listening. And I also thank uh, for giving me this opportunity to share my ideas with all of you. Thank you very much.
Now I request Ratnamala madam, okay, to read out the questions, whatever raised by the members.
First question from CH Uma Devi. How to differentiate ordinary coronavirus fever and normal viral fever?
Yes. Ordinary corona, like a normal viral fever, is also associated with fever and body pains. But coronavirus is associated with an upper respiratory tract illness. Either you have an irritation in the throat or irritation in the nose, either you will have a weird taste and smell, or some uneasiness in your upper respiratory tract. Why? Because the virus replicate in your upper respiratory tract, either the nose or the oral cavity. So when you have a coupled with these symptoms with the fever and the body aches, then definitely it is a COVID. When only fever and body aches is there, then it is another viral fever. Yes.
Next question, madam. What are the precautions required for primary school children in home and school? Question by Rajgopal.
Yes. Nice questions. That is what I have touched in my presentation, that strategies have to be implemented in educating preschool children. Preschool children are very much closer to their teachers when compared to the like parents at times when it comes to the learning atmospheres. So in case of preschool children, they have to be educated in a new ways. Previously, whenever we have rhymes, we go back to YouTube's. We show them animations. But right now, I feel that it is the time to generate a new method of transmitting this infection to preschool children. Maybe it is a very higher task to the teachers to develop new songs and hand washing, new songs and identifying symptoms, but it is the need of the hour. Yes.
One more question. It is similar to that by G. Rajeshwari, madam. Even though schools took precautions, how students will come to school without buses or some other vehicles which may not maintain social distance? How could we manage transportation is one
Yes.
question.
This is not only for the schools, but for the education institutes too, which provide buses for the commuting of the large students out there. We don't have any other option except to allow few percentage of students, and that too depending upon the external criteria. Depending upon the reduction of the cases only, then only we can shift back to the increasing number of students or a little bit of reduction of the distance with the masks, etc. But right now, in the scenario what we have, except maintaining the staggering distancing in the buses, asking them not to come by the public transport, asking them to come by their own transport, we don't have any other options. I'm sorry to say that, but this is what is the scenario we are facing.
One more question, madam. This is, I think,
Yes.
most common question. How to take precautions when someone from neighborhood got corona positive?
What I can say that mm, a neighbor coming positive or your own family becoming member becoming positive is one and the same. Let me tell you. Only thing is you maintain you maintain a safe hand washing precautions, cleaning precautions at your house is the same. How do you do these practices when your own family member becomes positive? If your neighbor has come positive, you have to identify and think for a few minutes that what are the common points you and your neighbor have visited, you and your neighbor have touched, you and your neighbor, like for example, if you had a chat, if you had a coffee, if you had a tea, if you have a dinner, think about those scenarios. If you did not have any of these scenarios, you are safe. If you had any of these scenarios with your neighbor, so I just take some few examples. Playing housey, okay, having sharing a tea in a less than 1 meter distance in this current scenario. So you should plan yourself which are the high risk activities you had with your neighbor, or similarly you had with your housemate, or you have your own family members. So that tells you whether you are at risk or you are not at risk.
One more question from Professor Trinadha Rao. When can we expect the decreasing trend in COVID-19?
Yes. Sir, please, if anybody want to touch this, please plot the rates of transmission in your respective places. So if I am addressing around approximately 75 to 80 people of educationers here, just try this. Plot your outbreak of cases in your respective government dashboards. Plot for about 14 days and see whether there is an increasing trend or a decreasing trend. This will be helping you in two ways: to predict your own infection rate in the neighborhood, and this is also useful to your educational institute, both. Yes.
And one more question, madam. Some of the members are consuming Ginkgovit and vitamin tablets. Is it advisable or not?
Sir, maintaining an immunity and health is always advisable. I still say that maybe that's my personal view. It might not match the many of the faculty view. Indian food, Indian contemporary food, the way we have to consume has got a lot of health potentials, which we have forgot and foregone in the recent years, if I am not wrong. With our busy schedules, what we have did is we have been accustomed ourselves to a more of a complex modern scenario where we cook for 2 to 3 days, we pack them in our refrigerators, we reheat it in our ovens, or we consume our hungry, or we suppress our hungry with the pizzas, with the so-called junk foods. Thank God that the lockdown has made us to go back to our normalcy, maybe to our old normalcy, old traditional things. Whatever you eat healthy food, you eat on time, you eat it in a hot way manner. And our traditional food, if you observe, if you have seen it, it always says that you just read the scriptures. I am not a particular religion, it's not that, sir. Every religion says that you eat a proper composite food. Every religion's composition of food is rich in proteins and advises that you eat it hot. So please practice your own food, your own competencies. So a rice with a fry curry, with a dal, with a curd, and always you might have remembering it back. A pinch of lemon pickle, a pinch of a mango pickle in your curd is very good. A rasam, which is filled with tamarind, which gives you enough vitamin C. Taking these supplements is okay, not a problem at all, because in previous 5 months before, whatever the deficiencies you had in these taking these supplements, you might have covered by this time. So maybe by this time, many of the faculty might have felt a lot more healthier than before when you have been working regularly, if I'm not wrong.
And actually, one more similar type, madam. Some of the people are consuming hydroxyquinone and other medicines as a precaution and preventive method. Is it advisable or not?
I say no, because hydroxyquinone, when advised and prescribed by the medical faculty, you take then only. If at all somebody are prescribed hydroxyquinone, either they are close contacts of a positive person or have been very close contacts of a sick person. Otherwise, hydroxyquinone is being advisable and advocated for healthcare personnel only when they routinely go to the hospitals where they have a frequent chance of exposures. But consuming hydroxyquinone without your proper pre-investigations is riskier. Hydroxyquinone is not supposed to be consumed without knowing your ECG pattern, your heart risks, and your hypertensions. So without knowing that, if you just take it or consume it based on any WhatsApp message, just like what I have reiterated, it is risky.
And one more question, madam. Is there any counseling facility available from the government side, as some of the affected patients are committing suicide, becoming panic and other things?
I am not aware of it, but I definitely know that AP government had got a telemedicine facility. But as a part of a humanitarian process, many of the psychologists and psychiatrists have started a helplines which you can browse on the net. These helplines are for free sessions and they are available for 24/7. But I'm not right now not aware of those sessions. But it is an initiative taken to support the mental health of the other fellow beings.
From of the college faculty only, if at all, if college reopens, what kind of precautions has to be taken in the hostels, especially to prevent COVID-19?
Hostels, you have to see from where the students are returning back. You have to see, this is a small technique to keep and track of the infection rate scenarios. So you have to segregate those students. But whenever a student or a faculty comes back, you should ask them their negative report and also their antibody test report. If antibody test is positive, the student is immune. There is no nothing that this student will not get reinfected. But at that moment, the student is immune. If the antibody test is negative and also antigen test is negative, that these students are at risk. So they are entering and these students are at chance of acquiring the infection. So these students, you should have a plan of implementation of checking their temperature, pulse rate, and a pulse oximeter. Nowadays, I incorporate all these three in an like monitoring checklist in every household and every hostel. Digital thermometer per individual, digital blood pressure monitor per individual, and a pulse oximeter finger probe. All these three has to be monitored and a monitor check has to be recorded. And this will help you, the hostel wardens, that they have been monitoring their students and these are the checklists available for the day-to-day monitoring. And any case of symptoms arise, you should have a plans and facilities to isolate them. Let me tell you, yes, quarantine them. Let me tell you that quarantine is something that you keep people separated in case of onset of symptoms and observe them whether they are worsening or not. If it is a normal cough and cold, it reduces by 3rd to 4th day. If it is not reducing, the fever is not reducing for 3 to 4 days associated with other symptoms, then these are warning symptoms which you have to start testing and take the other necessary implementations. If the person is positive, in test positive, then you have to isolate them, totally separate them, give them food to themselves, depending of their symptoms. After intimating to their parents, give them a choice of getting admitted into a hospital, etc. Okay, so these have to be planned. Either you are quarantining them or you are isolating them.
And actually, one more question, madam. What medicines we have to keep at home at this time? What supplement tablets? Question by Sridhar Maisa.
Yeah. Supplement tablets, whatever that improves your general health, that is fine. Taking a paracetamol in case of fever, you are suppressing it. You are suppressing the throat pain. Maybe that is the reason that government has imposed a ban on keeping antibiotics and them. But right now, it becomes imperative that without taking any painkillers, just observe your symptoms for 2 days. See where do you stand and what other symptoms do you have. Then go for testing. Right now, there are no facilities for the common clinics. So you don't have any other option other than testing. So if you, even the testing also, I just want to reiterate that the testing will become positive only after 48 hours with 90% or 67 to 90% efficacy. So observing your symptoms for 2 days is not a problem. Any serious symptoms or deleterious symptoms or drastic effects are observed only after 8th day. So it is always safer without taking any painkillers, observe your symptoms.
One more last question, madam. Is it advisable to drink Ayush herbal decoction daily, or is there any side effects for this? By Ramya Sri.
Yes. Ministry of Ayush and the decoction what you have been said is being advocated by our central government. So that means central government has not left any choice of taking advantage of every type of medicine, allopathic, Ayush, even yoga also. So it is not definite that only this will work or this will not work. Now we have to go in hand. So if you are able to tolerate that, so per day or at the times of symptoms, yes, you do continue it. But definitely approach for a testing in case of outbreak of symptoms. That, but definitely not be in an idea that this ice drink will kill the virus. This ice drink is going to cure out of the disease. This ice drink is, they clearly say, these are all immunity boosters. They are not virus killers. So as long as you don't have symptoms, you continue them. But once you have symptoms, observe for 2 days, definitely go for approaching of testing. Okay. So club the ideology for both.
Next, over to Professor Venkatnath sir. Venkatnath sir, please unmute yourself.
Yes, madam. Yeah. Here, thank you, madam. Here, two more members raised their hand. That
Yes.
is Abdul Javed. Sir, Abdul Javed, sir, you can raise your question, sir. Mr. Abdul Javed.
Sir, good morning, ma'am.
Yes, sir. Good morning, sir.
Ma'am, if we have, I think this question is related to what Ratnamala ma'am asked. Okay, if we have like just neighboring one or two houses, okay, if anyone is positive, what are the precautions? Because we have to move around and maybe we may come in contact with them, even though they stay indoors. What are the precautions we have to take, ma'am, so that it doesn't affect us?
Yes.
Thank
I
you.
want to apply this to not only to the neighborhood 2 and 3 houses also, but I also apply this to your apartment people. Remember that though this virus is very rapid in transmission, 80% people are asymptomatic, 80% people are recovering. Approximately 8 to 10% people are succumbing to it. God has given one resort that this virus can be killed with what? With regular soap and water and alcohol, 70% alcohol, or hypochlorite solution that is nothing but a common bleach. You might have seen that as soon as whenever there is an outbreak of infection, what does the municipality people will come and do? They'll come and spray the bleaching powder. Yes, this is for this thing, but is it for only for one day? No. When you are in a neighborhood hold or neighborhood, when you are in a collective neighborhood, you can plan spraying of 1% hypochlorite solution. I just want to take a small of this. I don't know whether this idea will work out in a community or not. Maybe we have forgot nowadays to spraying or sprinkling in front of our houses, and we used to keep rangoli, right?
Yes.
So we have forgot, we have got into changed into duplex apartment scenarios, everything. When you are in apartment scenario, cleaning in front of your houses with 1% bleach, do you know how much it comes around? One tablespoon of bleaching powder in a half bucket of water. Okay, or like a bleach liquid will be there. Okay,
Like
Clorox wipes are there. All you can do for a
hand raise.
cleaning or spraying of your in front of your houses, that prevents you from the spread of infection. If all the households come together and do it every day, twice a daily, remember that the virus is mitigated in the environment. Okay, but
Thank
not
you.
gatherings, no public
Thank you.
gatherings. Yes.
Yeah, here one more person, Neduru Sujata. Madam, can you please unmute and raise your question, madam? Neduru Sujata. Neduru Sujata, raise your hand. Okay, great. Okay, all right.
Actually, one more question is there. Is there time? Is there, sir?
Just a last question. Yeah.
Can I ask? Yeah.
Yeah, please go ahead for the last question, madam.
If any person from Geetam family has COVID emergency situation, is there any procedure to directly admit it to GIMSR hospital?
Let me tell you everything that COVID positive patients, GIMSR is now catering to the entire Visakhapatnam campus. It is designated as a district isolation hospital. That means, irrespective of the cadre, any positive person, if they are coming up with a confirmed positive report, Aadhaar card, and a referral letter from a local medical officer, they can be admitted straight away. Straight away. Whatever the treatment that is provided with all these three reports, they are put under CMC Aragyasri Padakam, and entire treatment is given for free, including the oxygen facilities, including the ventilator facilities. But with the rampant virus infection, the disease is so rampant that the entire ICU is being filled up totally. No ICU beds are a lot of scarcity now. And similarly, the oxygen line beds. So that is the scenario right now. Yes, not only GIMSR faculty, any persons, whoever has a confirmed positive report, you are directly admitted in GIMSR hospital. There are no hassles. Only thing is you have to share this with the government, like a hospital nodal officer, that's me, and an assistant nodal officer. We have a routing system by allowing in the security, and then from the triage room, and then directly admitting into the hospital. We have a meticulous monitor, and I am proud to say that the entire GIMSR hospital fraternity since past five months, they have been struggling hard. We have catered to around 1,500 inpatients. We have successful outcome in 780 patients successfully treated and left. Unfortunately, yes, we do have deaths also, but we could not have stopped it. And we have very few cases referred to the other higher institutes. This is the scenario.
One more common question.
Yes.
Is there any possibility to attack coronavirus twice for the same victim?
Yes, we did see that in two different cases. These two different cases out of 1,500 is an extremely rare, but it is also a possibility.
Many are there. Because of the time, we are not able to.
Okay, thank you, madam. Thank you very much for sparing your valuable time.
Thank you, sir.
Okay, we are thankful to both Dr. P. Hema Prakash Kumari Madam Garu for delivering an excellent information, and Dr. KVGD Balaji Garu, the Registrar of Geetam University, for presiding over for this curtain raiser program, and also to Professor K. Srinivas Garu, the Principal of GSS Bengaluru campus. Thank you, madam. Thank you, Balaji sir. Thank you, Srinivas sir. Thank you very much. Now I request, the participants to stay for 1 or 2 minutes so that I can explain you about this attendance as well as the feedback system. Okay, now I think already all of you received attendance and feedback links. I will show you just within 1 minute so that you can go through it. Yeah, so feedback form opens like this, and then you can give your register number. For each participant, we have given one register number. You can check your email. In that, we have given the register number to each and every participant, and the name of the participant, mobile number of the participant, and then email address of the participant. And after that, okay, they can give the feedback on the person. For example, today, Dr. Hema Prakash Kumari madam has given on healthy and safe learning environment. You can give the feedback, either strongly agree or strongly disagree or in between, number 1 to 5 scale. And then 3 more options are given to you. Those are, you can elaborate the points on which you agree with the speaker, elaborate the points on which you disagree with the speaker, and elaborate the points that you want to further add. So like this, for each and every speaker, 3 more options will be available. So if you are going to submit this information, based on that, we are going to select the best participants. So here you have to give the analytical mode of answer. Based on the analytical mode of the answer, you will be given the best participant for the few members out of the registered candidates. So 4 to 5 members will be selected. And attendance is also like this, simple one, a registered number, name of the participant, mobile number, and the email of the participant. So these are the things you have to fill up, and all the links for attendance as well as the feedback, all of them were shared with you already. But the only one issue is they will become active on that particular day only. On that particular day only, they will become active. So this is information about attendance and feedback forms and the best participant awards, whatever are there. And then if you have any query, you can email us at any time. And the regular program will start on 17. There will be an inaugural session for a period of 5 to 6 minutes, followed by the regular sessions, whatever are there. So this is about the program schedule. And one more issue is about 22nd. On 22nd, as Vinayak Chaturthi is there, some of the participants requested to reschedule. That's why on only 22nd, the program will be in the afternoon session from 3 to 5:30. As far as the Sunday is concerned, it will be as usual morning. And the last announcement is regarding the tools, whatever required for the online teaching. We are going to send one more link to all the participants in case if they want to have hands-on experience regarding the Google Form, Google Sheets, Moodles, etc. We will conduct in the form of the workshop, or if they feel that it is enough if we give in the form of a seminar like lecture, that's up to you. So you can choose that one. If you are going to choose the workshop mode, we are going to give a separate certificate for that. Okay, this is about the information. If you have any query, you can email to us. So with this, I am so thankful to the registrar sir, KVGD Balaji Garu, the participants, and Dr. Ratnamala and all other members. Thank you very much.
Thank you.